Hi, everyone. Paul just called the meeting to order, and I've been having technical difficulties with the online, so we're gonna get started now. So when I call your name, please let me know if you are here. Amanda Archer. Anyone else with Mendocino County Youth Project? Ashley Hathaway. Here. Live post. Stepped out too. She's here, she's present, she just stepped out, she'll be right back. Faith Day, present. Hannah Nanas, here. Joanne Brewer, here. Joanna Olson, here. Kitty Albert, present. Camille Leggett, here. Priest Martinez, let me know that he is going to be absent today. Teresa DeSimone or anyone with CDC, also let me know that she's not going to be able to make it today. And Paul Davis. Here. Okay, we have a quorum.
All right. We're going to open things up for public comment on any non-agendized items. Do you have any public comments? Okay, we'll move to approval of minutes for the June 16, 2025 COC board meeting. Minutes are attached here.
I move to approve the minutes of June 16th, 2025.
Thanks, Judy. Second for that.
That was actually,
Yeah.
okay, just for the minutes, just so we're clear.
Any comments on the minutes, updates, changes, corrections? There's no discussion. Veronica, can you take the vote?
Yes, when I call your name, please let me know if you vote yes, no, or abstain to approving the minutes. Ashley.
Yes.
Live.
Stay.
Faith.
Yes.
Nat. I mean Hannah. Abstain. Joanne.
Me?
Brewer.
Yes.
Joanna.
Yes.
Judy.
Yes.
Neil. Yes. Motion approved.
All right. We're gonna move on to announcements. Anybody has any announcements?
I do, and I left the flyers on my desk. So maybe I'll have Amy run back and grab them, but don't worry, I'll tell you in a minute where they're at. But in Willits, it's an announcement about public meals. Our Daily Bread has been guiding an evening meal Monday through Thursday. And then the churches have been doing Saturday and Sunday, but there's been a void on Fridays. Food Not Bombs, Willits chapter has started up and they're providing a meal on the first and third Fridays of the month at 5 o'clock, either at the Rec Grove or in front of the library, depending on events. So we'll pass out a flyer here.
Any other announcements? Now we'll move on to reports and presentations and start with updates from local jurisdictions. Again, County of Mendocino.
It's been pretty quiet. There's not a lot to report from the county side. I did want two FYIs to the board that there may be some follow-up to the board at some point in the future. I'm meeting with the behavioral health department, Karen Lovato, it's either this week or next week, I can't remember what, to get a better grasp on the behavioral health housing projects. I know she gave an update to this board, but it might have been almost a year ago now. It was a long time ago. And at the time there was a lot of this is going to happen. And so we're one of the themes that came out of the stakeholder meetings, but it wasn't a surprise to me, but it's been a theme all along, is that communication and coordination between the pretty significant housing programs specifically for behavioral health clients and the rest of the kind of mainstream housing programs is not quite as close and seamless as we would like. So that's still my intention, to be able to better understand the behavioral health housing programs available in this county and how referrals can be made, how we can access those programs, how we can figure out who can pay for, rental assistance and things like that within within that world. So at this point, Veronica and I are meeting with Karen next week, but I just wanted the board to know that I think that's something that we're all interested in. And so I'm going to try to figure out how to get that information flowing back and forth more coherently. Because if you ask me right now what behavioral health housing opportunities are available in Mendocino County, I actually don't think I could answer very well. And I should know. We all should know.
We should answer what RCS operates and oversees, like Valley House and the Blue House and things like that.
But even how to get a client in that, we wouldn't even necessarily know, which might be fine. Maybe there is no way, maybe it's internal. So like, we only know what things, we know some, and I think we'd all benefit from having a clearer idea of how to connect people to those resources. The other FYI I wanted to give this board is that there have been discussions internally here at the county, also with Paul at Hospitality Center, about the Plateau's tenant selection process. It's not quite going the way the community would like in the city of Fort Bragg, and we're starting to explore some different ideas of how to address those needs. I think some element of that may or may not come back to the COC board in the future, but I wanted to let you know that those conversations are happening. And that's it. So it's a bunch of like talk, but I don't have any action to report on today. Oh, yeah, sure. Go ahead.
I have a question. So we taking information from county behavioral health and we combine it with this department of what we know. Could we perhaps develop some sort of flyer to hand out to people? Because we have people contact us at McCabe, and all I can tell them is contact RCS, people that I know that got funding, and I know they're and then of course the CDC, contact them. So it would be really great if providers had a list.
I totally agree.
I have a list and a flyer.
I think, do you have a list of how you specifically apply to behavioral health funding for rental assistance, something like that? Because that's.
No, I'm working on creating a map of all of our community support providers. I have a flyer that I'm updating, but it is a flyer with all of our, all of you on it.
Mm-hmm.
But the flyer could not, obviously it's not enough room to incorporate the how-to.
Right.
And now I have a resource book available that has the how-to for each provider. That would be our next step. At that and updating the map so that we can hand that out. So at least they have all of the community providers' name and contact information. But we have file shares, we have bus stop, we have the bus station.
Things beyond housing, just basic.
Yeah,
needs.
so
Mhm.
all your essential needs, we have a flyer for that I can share with you guys.
Be great.
And then
we also do a pamphlet for homeless families for the start of the school year based on inland and coastal of like what churches are serving foods at what times, and we're working on updating that, so we'll have that for 25-26 school year here.
I think we all welcome anybody's samples of like flyers that you use for your clients. For what I was specifically talking about, Joanna, was those of us who are in the housing group providing services world, understanding exactly how you can access these resources, probably not something that you would hand out to the client. It's something that we would understand internally.
like an MOU.
No, I'm looking for, if I have a client that I know is engaged in SUD services, and I know for sure the county has received money to support housing for people engaged in SUDD, how does that person specifically access it? Same with the severe mental illness.
Yeah, that'd be
So there are,
Right, we need that for our MAP program too.
and right,
Yeah.
at the state level, there are considerable resources shifting to housing for people with behavioral health needs. Lots of funding that has gone in that direction, more so than the general population. It's getting a little kind of targeted. And my impression is that because the behavioral health department has not typically been the housing providers, it's taken them longer to build up that infrastructure and understand how to get it back out into the community in a way that meets all of their restrictions, all their confidentiality requirements, all the crap they have to go through, which is a pretty extensive layer of stuff. But at the end of the day, if someone's coming to me because they're about to be evicted and I know they have a severe mental illness, I want to find out the best, most efficient way to help them preserve that housing. And I'm afraid that we're using some of our general population resources when these other resources that might be actually more robust are available to them. It's particularly important because if and when the county ever gets transitional rent together through the Medi-Cal system, that is specifically for that population. So there's a lot of really detailed opportunity in that world. Again, that's what people with substance use or mental health that we generalists haven't been as deeply aware of.
No, I agree with you, and that fear is a reality. I mean, we do utilize local services for, for clients that are suffering with SUD and mental health issues. When there is a more robust, more targeted benefits that they could be receiving, that's a real thing that is happening every day.
Okay. Okay, I'm gonna jump in just because what I would say also is for some of you who just live in that housing world of like, I'm a housing navigator and I just really want to help with this. I also just think for those of us who work with clients who are desperately looking for housing also, that, really, again, just getting the updates of what is really going on. I think it's so frustrating for clients in terms of the level of paperwork and what they follow, and we know that they already fall through the cracks anyway. You can't send them a CDC. There are no vouchers. It's not open, and there's probably going to be more cutbacks.
Right.
You send them to all the low-income housing. The waiting list is 2 to 3 years. Like they're going to have to find a special crack that they might be able to walk through and get. Because I think us saying, here, look at what's available, and then just hitting a wall again means that
It's sort of demoralizing.
demoralizing.
Yeah.
So I'd rather make sure that they're getting good information or realistic in terms of what's possible for them. But I feel like we who are giving the information should also know what's actually happening out there.
And those resources constantly shift and change. So even if we thought something was true 3 months ago, it might not be true anymore. So that's why it's even more important that we are as up to date as we can be
Right.
on what resources are available or not available. Yeah. And how to access them.
So what I'd like to ask is that when you meet with them, we keep hearing, I keep seeing and having people ask, how is the CSC being included in the development of the behavioral health bridge housing? And I haven't heard it. How that is being rolled out, because this guidance from the state is that there is supposed to be coordination and collaboration between the COC and behavioral health to roll out the bridge housing funds and the other behavioral health housing components that are being implemented under the new budget and legislation. And so that would be really good information to know is how are we doing that?
It's a good question. And I will ask, I will start that conversation with Karen. I felt like the time is now.
Yeah.
I know that last time we had a date, I don't think they were building something and they were not really sure how it was going to unfold, but it's becoming more urgent that we're aware of how that's going to work and how we're going to be informed or involved.
And the other piece that you brought up around transitional rent, that the state really wants counties to have a flex fund that is coordinated between all of these different entities. That is like, it sounds like madness.
Yes,
but
it does sound like madness.
We've been, definitely very.
No, I think that's
out and
how
to access transitional rent, and do individual organizations do contracts with the CPs, or do we anyway? So
I think that I think it's a tremendously complicated,
Yeah.
like, expectation and hope of the state. Also probably the right one. I mean, I get the vision.
Mandating it. It's not.
No, not the flex fund, but the transitional rent at some point is coming, and I think we're gonna be late to that party for sure. I can't see how we're not gonna be late to that party. But again, a lot of this infrastructure and resources have been shifted very specifically to the behavioral health department to be the hub, which is different from some of the other programs have been. So,
Managed care plans are required to have transitional rents implemented by first.
I think what I'm confused by is if the county behavioral health department is just literally not ready for it yet. I just don't know how that happens, but we'll see.
It's a requirement of the managed care plan, not county behavioral health.
But the managed care plans don't run the SMI populations.
I understand.
Yeah, they don't actually, so
The state regs.
I think the state is requiring it. If the county is not ready, I just literally don't know what happens. So those are good questions for us to be able to ask behavioral health.
What's the definition of transitional?
So transitional rent is going to be a new Medi-Cal benefit.
Oh, wow, to all Medi-Cal.
To Medi-Cal recipients, that's the language I'm using.
They are.
Medi-Cal benefit to Medi-Cal recipients who meet the criteria of having a severe mental illness. There might be some behavioral health in there also as well. And it's 6 months of rent. And it's meant to be transitioning out of you're transitioning out of like or you were in a mental health facility and you're homeless and you're transitioning back into the community. You've been in a facility.
Does that include substance use inpatient?
I think it does. I can't, this is the part that's really tricky.
Is that through partnership?
It will be through partnership, but the identification of the patients, the contracting, a lot of the county behavioral health has to be deeply involved. They have to endorse the contracts and they have to be deeply involved because Medi-Cal managed care programs don't actually manage individuals with severe mental illness. That happens through the county. So it's a complicated relationship and a complicated benefit. And, whoever is doing it is supposed to be shelling out the rent and then getting reimbursed for it. So everything about it is complicated and hard and seems really risky to me.
Would rent be considered a motel room?
No,
No.
but not unless there's a lease and a kitchen and it meets the standards for a place of human habitation as a permanent residence.
There is another benefit. It's some form of room and board for I don't know if it's sleaze, but it's not sleaze. But it's some form of room and board that counts against that same benefit, even when it's not like a rental situation. And so there's a bunch of other COCs in the state who are kind of floundering on, well, when does the clock start and what is counts against the 6 months? It's more than just transitional rents. There's other benefits that count against the same timeline. It's really
it's much more of a restrictive population than I had hoped. So that's what we're using. Yeah.
So money is being shifted from one pot to this pot.
No, I mean, this is a clever way for the state to access Medi-Cal money, which again, there's so many things happening at the federal level. We're all a little bit like, what? So it's a way to access healthcare related money for housing. And the nexus they can make is that if somebody with a severe substance use issue or somebody with a severe mental illness is able to be housed, they can show savings to the healthcare system. So that's the way they were able to do it. They have data that shows that someone with severe mental illness or someone suffering from a severe substance use, when housed, causes less cost to the healthcare system. They can justify that. That's why it ended up being this narrow population. You can't quite justify the general population yet creating less healthcare costs when they're
Without building special housing to house these.
transitional rent is not for special housing to house these people, right? So there's a question, is the biggest barrier for these individuals the rental assistance or is the biggest barrier the housing itself? Right. I don't know.
Yeah.
And it's a different Medi-Cal waiver or Medicaid waiver that transitional rents is under than the Cal aid. And so we actually have a longer timeline from right now for transitional rents than we do community supports.
It's super complicated. But I don't want to take too much time on it. So my point is, obviously, we all need more like kind of understanding both what is available now and what's on the horizon.
I just have, so on the coordinated entry, or on the plateau and like kind of what you were referring to, that it might come back, that I just want to share about that when they did the most recent poll for the plateau of the referrals that they wanted to seek out, one of the challenges that came up is that we had, as a coordinated entry committee and as a board, and SCOC had changed the way that we're doing coordinated entry to be able to look at, in order for physical housing facilities like the plateau or like Oak Creek Commons, that we're asking people what area of the county they want to be housed in. And then we'll use, when we're doing the referrals and the polls for places like the plateau, they would only be looking at the people who were interested in living in Fort Bragg. And so we negotiated and done all of that, but the timing of the most recent poll happened before the implementation of that geographic preference. And so the ones that we're seeing getting into the plateau right now, I really pushed to try to see if we could wait on that poll for the 2 weeks that it took, for it to come to the board and get approved. They couldn't wait. So I just think that's an important thing to keep in mind as we're talking through this stuff, that we don't know yet how that geographic preference and from the people we're screening is going to play out in terms of when the next poll will only be from this list of people that are wanting to live in Fort Bragg.
I think there were multiple problems with the last poll. There's multiple there's multiple aspects of the tenant selection process right now that are influencing what's happening. And so I think that the geographic preference is important, and really looking forward to seeing that outcome as well. But there's other things that need to be as well in that whole system. The coordinated entry tool itself is generating higher scores for individuals that may or may not be City of Fort Bragg's priority. There's questions about how the scoring is happening. Some of the accuracy of the scoring has been a little bit not quite what we wanted. So there's a lot of different things to look at. And ultimately, we have a year and a half of experience with the plateau tenant selection, and it's not meeting City of Fort Bragg's needs right now.
There's also a cutoff of a score of 22. Anything 21 or lower is not considered for the plateau. There's very few Fort Bragg residents or people in Fort Bragg experiencing homelessness that have a score of 22 or higher. So that's also a limiting factor. And there's lots of complicating factors here that are at play. So we're trying to support weaving through that and stay in our lane of coordinated entry.
So TBD on that.
So Megan, one last thing, not to beat a dead horse.
Can't
but,
speak. We got some time today.
There's also, a shift in funding to say dollar.
Right.
Shifting from programs like wellness centers to
To housing, right?
housing.
Yeah. That's a good point. There's so many things within the behavioral health department. I get them all muddled in my own
Will
head.
be for that time. Will be that.
Housing providers are expected to.
To City of Ukiah, Shannon.
Good afternoon. I don't think I have any major announcements. We're still tearing up the streets per usual. We are wrapping up on Gobi and Maine though, and we did get an award of grant for Leslie Street, which will be a big improvement for the senior center. So next year, Leslie Street will be redone. We'll be adding sidewalks and pedestrian enhancements, which will be a big benefit again to the senior center and the school there. And it will hopefully help connect those populations to the courthouse site and the rail trail as well. We're working on purchasing a little piece of property that would extend Clay Street all the way to Leslie, where it would connect with Peach and then subsequently Orchard. So providing some additional connectivity, particularly for those who are mobility challenged. I don't think I have anything else unless anyone has any questions. Thank you.
Thanks, Shannon. Anybody have any questions or comments, public comment? All right, then we will move on to City of Fort Bragg. Hannah?
I don't have any updates for city program.
Any other jurisdictions with a report? Okay, we'll move on to standing committee reports. And first on the list is strategic planning.
I'm gonna schedule a meeting in September. We finished the stakeholder meetings. Veronica's been super consumed with getting HAP6 done. It's an incredibly onerous application. So that was kind of the milestone I wanted to finish before we picked up the strategic planning process, because we'll have a little bit of a breather after that to go more deeply into the stakeholder feedback and the information that was gathered during the HAP6 process, and we'll be ready to go at that time.
So we have some points of discussion that I think fit best under the strategic planning committee. They were brought up by Camille. She's got a couple of points. Do you want to dive in, or do you want me to read your email, or?
You could just read the email.
Okay.
I know Priest is not here, so I don't want to put anyone out there because he's not here, but these were like also Priest ideas as well.
And these are kind of ideas on, I could see using the strategic planning committee could use to help implement some of the strategies that we've struggled to implement, like the public engagement and things like that. So just have that in mind while I read this. We think it would be helpful to use the information that we've acquired in the public, in the strategic feedback sessions, and for the strategic plan to create a COC meeting of the minds, collaboration solutions to housing. I would like to propose that we work with other COCs in California to arrange a meeting in Sacramento, possibly using HAP or other funding to arrange COC members and organizations to meet and develop solutions in breakout sessions and collaborative sessions on ways to build towards housing solutions. I want to pause there because there's two ideas here. So that's the first one.
Yes. So essentially the idea is, and I kind of got this idea doing a collaborative meeting eons ago. That was like years and years ago, like 15 years, 12 years ago. When we were working on an opioid crisis prevention, like a national, I was working for Children and Families Futures in Orange County, and they assist with like the opioid crisis on the East Coast, as well as in the Midwest and on the West Coast as well. And so they would all come together, because even though their populations are different, their people are different, all of these things are, attacking their communities are the same, and their communities are different in their infrastructure. They all have similarities and ways that they were able to share solutions, what worked in their communities, what didn't work based off of their communities. And sometimes when you have different populations coming together, you can say, oh, you're a rural community as well. You have such and such amount of people as well. You have lack of job industries in your area. You have this, you have that. How did you work in frames of housing and sustainability for long term? And they were like, hey, this is what we implemented. And it's such a great way to work together, create the solutions in a actual environment where we're not just talking, but we're putting these strategic planning facts or data that we received, and we're creating some actual action plans. And it's something that can be created, I guess, progress like the first year, second year, third year, right? Fourth year term with like fireworks at the end of the fourth year. That was a joke. No one got it. And I think that's about it. Yeah. Oh, and then the second option, if you wanna, sorry.
Well, I kind of think maybe we should discuss that a little bit because, I mean, this is it's follow-up, but it's kind of, I think it's a separate concept.
Oh,
So-
yeah, that was the,
Are you guys, the board, how do you feel about that? What you just talked
Could we hear how that might look like, logistically? Like how does something like that get planned and come about?
so normally you have like a planning committee that's usually the strategic planning committee can also be a part of that. And there's please help me with this acronym because there's a million in my head from writing grants, but I think it's community rural development housing or community
Rural
CDP.
Communities Assistance Corporation or
The CAC?
No.
This one is like the department. It's not HCD, it's California Rural
HPD?
Housing
Oh,
something.
I
Yeah.
don't know.
Yeah. It's
A division
Yeah.
in CDs in,
It's a division of California Housing, so it's CHCDHP or something of that nature. I will get the acronym correct. I should know this.
are you talking about the Homeless Policy Division, HPD, HCD's HPD?
No, they assist with funding for rural communities as well with HCD, and they actually partner with them. But yeah, I will get that acronym. I feel bad because I was in a conference with them in Monterey Bay, and it was a really good conference. But anyway, yes, the COCs would work together, and then depending on other COCs that would get involved, usually you can bring in that CHDP, and the acronym may be incorrect. You can get them to assist as well. They have a lot of technical assistance and they can provide support with the planning process and getting all of the COCs who are interested together for the meeting of the minds. So there's extra help that's not coming from everybody.
So I could see Cal ICH helping with this. This is some kind of an initiative like this. And I'm a member of the California COC Alliance. It's the different collaborative applicants. And we just have this like online alliance. But we've talked about having a meeting and this could be an idea behind it.
So are we asking for like a ad hoc or a separate subcommittee of the strategic planning committee to?
Or have the strategic planning committee look at that as, yes, we're developing this plan, but how do we implement these strategies and come up with these solutions? And when we're looking at what solutions do we choose, it needs to be informed by something, and this could help us inform it.
So it's called the California Rural Housing Department. Or the California Rural Housing and Indian Housing Departments.
I mean, it does feel to me like it probably belongs in the strategic committee, planning committee to kind of understand more what the opportunity is. And if we are going to pursue either taking a leadership role or joining another kind of existing collaboration around this, it should be in our strategic plan, right? Like we should try to coordinate, we should try to condense and prioritize what we're doing through that planning process, I think.
So am I gathering that the board's on board with the strategic planning committee taking this on as a discussion and looking at that? Nobody's like against that.
Camille, would this be something that you and or Priest would be willing to provide an outline of how planning that looks, or do you have an idea about that?
I have an idea of it. I don't want to call out the California Rural Housing Department and be like, they're gonna help.
Make a plan for them.
Well, maybe there's a list and maybe
Yeah, I could do like a proposal or projection.
what we do first, what we do second. And, I don't know.
Yeah. It's a little bit, it's more intense once you get into it, but getting it started and the strategic planning of it. And then once we can get additional assistance, if we can get some TA assistance or even use some HAP funds, we will be able to bring in that TA division that can bring all the COCs together. And so having that would be, I don't know, I've never heard of a collaborative COC meeting ever, which would be really interesting to have, or at least we wouldn't have to have the whole state of California, even though I think that would be awesome. Just having at least the rural California communities getting together. I think that would be very beneficial and helpful. And maybe they could see some of the things we're doing great and they can implement it as well. It's like sharing knowledge.
Awesome.
Yeah, I mean, I think deferring it to the strategic planning committee makes some sense so that we're not going in two different directions.
Right. Okay, cool. Second one, to increase our community engagement and transparency, shedding light on our successes and our data and individuals with lived experience, I, Camille, would like to propose a community engagement team who could contract to provide education, awareness, and information about our COC on Facebook, Instagram, news outlets, and community pages, which could help clear some of the misconceptions about homelessness and solutions. You want me to keep reading? Have it in parentheses, so about the content.
Yeah, we
Okay.
leave the parentheses out. So it's not going to be me. I'm one human being. It's social media and me and technology. It's a love-hate relationship. More like hate some days than love. So me doing the social media would not be the case. I just thought this would be a very good big benefit because there are a lot of misnomers going around about the new transitions and how our funding is prioritizing homelessness funds. And there is a lack of knowledge on what could possibly work, and it's not an all size fits all one glove that hits everyone in everyone's community. So I think having a lot of our just the benefits of all the work that you guys have been doing in the community showcase and how the collaborative work and efforts, although it's not perfect, right? It's a lot better than a lot of places. Not saying anything bad, but just saying we're doing something right. And I think the community needs to know that instead of just looking at one or two unhoused people outside a gas station and saying, see, they're not doing anything, right? But they're not understanding the depth or the, you know, what we're actually doing behind the scenes. And I think having some of that data, having a face to the organizations, maybe having the marketer go out and let's say the marketer will go to like RCS and will go to one of their housing facilities and they'll walk in and do like a quick, like for an empty one, they'll do a quick like video and say, hey, look at our new built, you know, housing built project. It's helped house X amount of people. We've exceeded our goal here and there, and just showcasing a lot of the successes. We always hear about the negatives, and those negatives are kind of fueling where we're going in this whole funding perspective with those misnomers. So I just thought it would be a great idea, and just want to get your guys' thoughts on that.
Camille is probably gonna be a silly question and show my age, but when you say the marketer, what do you mean by that?
So it's a person who does like social media. So they'll do Instagram, Facebook, the Facebook page that probably hasn't been updated since the dinosaur age. I'm just kidding. The Facebook page, they would go out and they'd reach out to a lot of news outlets periodically and let them know like, hey, this is our new recent data report. Here's some basic facts on what we're doing right. Here's where we're transitioning into. Here's our focus with the strategic plan. It helps inform the public because a lot of the public are not going to watch the 2 hours and 30 minutes of our meetings. They want something quick that they can digest. And if we do it through a news outlet and we do it through social media, there's multiple ways that we can reach communities.
So in your vision, this person is who, like not a name, but it's folks from our agencies?
Yeah,
or-
folks from our agency that make up the COC and that are part of the COC and even the COC in itself. So it's the COC agencies and the COC as a whole.
And you would actually recommend that the COC contract with a consultant of some kind.
Yeah.
To help, like.
Yeah, sorry.
The ways
Yeah.
of doing this.
Yeah.
So this group of the members or whatever would be advising, this is what we want to have happen. But like we had Jendi Corsi, who we hired to do our website, you know, that
So
kind of.
it sounds like you're suggesting that the COC direct Veronica to research and enter into a PR marketing contract.
Yeah. I think it will help with the CAC getting members. It will help if, you know, we decide to move forward with this meeting of the minds and getting people to know what that is and what we're
I
doing.
mean, I think if we're frank, I'll be frank. This has been a goal of the COC for years and we've done nothing with it because it was really hard to put the attention into it. And frankly, none of us are professional marketers. So I don't even know if we're very good at it. I'll speak for myself. I'm not very good at it. But I think it's kind of long overdue. I don't know how much I want to wait. I mean, I would suspect it was going to become one of the goals of the strategic plan, but I also know that developing a contract and entering into a contract and doing that whole process with the county can take a really long time. So if the COC board, I'm just speaking out of turn here, Veronica, so shut me down whenever you want. But if the COC board directed Veronica and I to research what a PR contract, a public relations contract would look like, what funding sources could be available, what would be realistic, we could take that direction.
Yes, please. We could use HAP admin or system support.
Well, you and I can come up with a different.
Yeah, no,
we
just-
too, but there's like that, I think you're, but we can come back to the board with a proposal for what a public relations contract could look like, what a scope of work could look like, what the funding source could be.
Community engagement.
There's a fair amount of, I wouldn't say freedom, but when contracts are less than $50,000, we don't have to go through an RFP process, which is really, would take forever and all of that. So like Veronica knows all those ins and outs. I think Camille is right. If we wait around for us to get together to do this, we'll be waiting for another 3 years without professional help. I'm sorry, just to be super frank. I know Mo would probably totally agree. She's been asking us to do this for a really long time. So
It came up loud and clear in the one stakeholder session that I was in.
yeah,
I can't imagine it not being a goal in the strategic plan.
I can't imagine either. So if we
Look
know
at
it's
it.
going to be, I mean, we know it's a goal because it was in the last one and we didn't. So and we also think it's important.
Experience sessions. I mean, this is important.
Yeah.
So, just FYI, just so it's not a slippery slope, to call PR into the slippery slope of lobbying. This is technically community engagement, because you're providing education to the community, et cetera. So we have to just be a little bit careful with some of the words. But yes, the marketer would also like reach out to Mo, do like an interview on her perspective of homelessness, same thing with Priest. Provide a little bit of information, do fun little reels and videos and interviews, and it can be done very well. And I think there needs to be a visual snapshot for the community to see, other than just small little snapshots of what they see when they're driving around.
Or Mendoza.
Mhm.
But we need like our
Honestly, I think the local media would welcome it. They would love more
Mhm.
information and
They can share that instead of the negative.
yes.
they can work with the community engagement specialist that we hire.
When you nail down your strategic plan, your scope of work is really going to drive the cost. You mentioned that being a huge variable at that 50,000 mark, because PR firm, you're there, and you use the word marketer, you're not. So if you're reaching out for an independent marketing consultant versus a PR firm, it's a big difference in scope of work and pricing. So, I mean, first narrow it down to.
I guess we're not marketing anything, so marketing is not the right word. You're right.
Well,
We're
I mean,
not selling anything.
Still that independent, an independent marketer is going to handle the things that she mentioned in the scope of work in this debrief right here with the press releases and social media. So really narrowing down what are you looking for and not going out and getting quotes for a Lexus when you really just need a Honda.
Right. I think we can easily start with a Honda.
Yeah, which is going to drive where Veronica looks. And then is also going to drive what type of
Right.
approval you need, just by 2 cents from my marketing background.
Right.
Because what I see is like people with lived experience, if they're okay with signing a release, use their name or their face or whatever, to have them talk about some of their experiences with your organization that are positive, of course, and telling them like, hey, I used to get services with RCS and now I'm fully housed and now I'm doing well and all of these great things. And I think that's what the community needs to see more of too, as the lived experience.
We do press releases, but I could request more.
That would be perfect.
So are we getting direction?
Do we need a motion or?
Do we have?
Well, I think we'll just bring them to the strategic planning committee as we've got 2 more agenda items for our next meeting. And then they can come up with, this is how we'd like to do it and bring it back to the board.
Okay.
So we don't have to vote on anything or.
Because we don't really have
can't
that.
vote on it.
Yeah.
I think these are great ideas. Thank you for your contributions.
The first one was priest, so I'm not gonna take all his.
So I'll just make sure that at the next strategic planning committee meeting agenda, there's an action item, right, related to whether or not we should seek a contract for a community engagement specialist.
Yeah.
Okay.
And the statewide.
And then, right, that too, is separate.
Yeah, 2 separate ideas, but same committee.
Everybody feel like strategic planning is wrapped up?
Yeah.
We'll move on to the shelter and solutions, Veronica.
I wasn't able to pull off rescheduling the Miss July meeting. So we'll meet again September 10th at 1 p.m. I believe it's in this room, but it could be Shasta. I don't have it in front of me. We're gonna revisit we came up with a interim shelter plan. We're gonna talk about that next time, just so that we're back on the same page, but we thought that the emergency shelter written standards in the way that they were written address both congregate and non-congregate shelter. And I think that they just decided that there wasn't a need to have a special call out for voucher-based emergency shelter. Get that right, Judy, I think?
I can get to attend that meeting.
Oh, okay. Okay, yeah. And that's what we had brought back to this board. I think it was in June. Yeah. So we'll have our next meeting. We'll briefly touch on that. We've been working with the Willett Shelter Action Group on just our experience and how emergency shelters work in Mendocino County and how to support them. They've got their 501c3 they announced at the last meeting. So I've also been approached by Willett's Community Services about operating a winter-based or weather-based non-congregate shelter similar to what City of Fort Bragg or Police Department does. It's been a goal of the COC to have one. We were going to do Willett's Shelter Action Group, but if they're not in a position in the next few months to really be operating a program like that, we may need to use Willett's Community Services. So in the next RFP that has shelter on it, which we've talked about in the past, I'll make a note in there specifically for a Willett's emergency weather-based shelter, North County based. So we'll talk about that.
think that's enough for our next meeting. Joanne and I will meet to come up with an agenda.
Veronica, any questions or comments? All right. Let's move on to coordinated entry and discharge planning, Veronica.
The next committee meeting is October 16th at 9 a.m.
In the Shasta Conference Room in the next section of this building. We are having a work group meeting this Thursday, also at 9 a.m., exclusively online. If you want to be part of that and you're not on the invitation, let me know. We're looking at data collection for the new question on what regions of the county folks want to be housed in. We're going to be talking about the referral process from the landlord or the housing provider that has coordinated entry participating unit or rental assistance opportunity. And what the committee wants them to provide to us so that we can provide better referrals to them. Is it a 1-bedroom, so we don't give you a family of 4, things like that, to where it narrows down the pool of eligible referrals for not just an entire program, but rather a specific opportunity. We've been talking in the coordinated entry planning, like oversight management team about our prioritization, and that it hasn't been revised in a while, and that nobody likes the way I said that. And so we're kind of coming up and brainstorming ideas on how to bring that to the committee about what needs to change or how to change it. So there's some big stuff. It's going well, but we're making constant improvements. And Megan already talked about the plateau thing, so I'm not gonna, but that has been a discussion within that committee as well, so it's come up and we're looking at it.
Thanks, Veronica. Any questions or comments? All right, we're gonna move on to community accountability.
To give you guys an update, so we've been having a little bit of difficulty with, even I myself am not exempt from that, having a little bit of issues with scheduling times with everyone. I know I have to follow up with another committee member whom I haven't been able to get in touch with, and she's like taking the position. So I know, Veronica, I'm gonna probably have to CC you in that email to see if that person is still interested, and if not, then we're probably gonna have to move forward and have someone else be in her position. So that's where we're at with that. I do want to get started with scheduling that meeting. I know since we're coming to a close and all the kids are getting back into school for August, I would like to schedule it for next week or the following week, so we can start building up that momentum, because I know that there are several community events that are coming up that I would like for us to get prepared for, or possibly discuss tabling and talking about the CAC and the COC at like possibly the Pumpkin Fest or the Redwood Empire Fair, or there are several other community events happening as well. So I just wanted to double check and see if that is a possibility, and if so, I don't mind assisting with like helping to make the brochures, but I'm not sure in the logistics on where the money is coming from to print them and all that. And I know, Veronica, you have all those answers. So that's another question. And I don't want to do all of the majority work. I want us to do it as a collaborative, right? So it would be nice if, when everything is not as chaotic with the summer and school, for everyone to start jumping in and all hands on deck on some of these tasks that will need to be done.
And so my apologies, I haven't been on the board in a while. I'm wondering what are the goals of the committee? What's the community accountability group's goals? Like, what are they working on?
So right now, we've been trying to work on getting everyone scheduled in our meetings. Our focus is, number one, to increase our accountability efforts on making sure that the individuals who are receiving services from our members are stating that they're feeling like they're being helped, they're being listened to, et cetera. It's also a way for the agencies to increase their data methods, to include more lived experience data methods, include more policies and procedures that can be used to understand how you can increase your service delivery. But mainly the Community Accountability Committee is working towards providing methods in which we can work with lived experience organization or individuals who can go out and talk about that, not only talk about their experiences, but also serve on making some of those policy changes as a COC. And also include some of the information that will be on some of the grants that a lot of the agencies will be applying for. One of the questions we had on the previous, I think it was that we were working on. No, it was the previous grant we were working on, and it asked at 5. We included a question that talked about diversity, equity, and inclusion. We also included questions about how you incorporate lived experience. Although I do have great ideas and I have lived experience, and I also have professional experience, I'm not knowledgeable in all things, and I would like to have more voices in the table in those policy meetings.
Is that it?
Comments? All right, we'll move on to membership committee, Veronica.
They're meeting jointly with the Community Accountability Committee. And so it's kind of a combination of the two approaches. Because the Community Accountability Committee is looking at being transparent, having lived experience voices, making sure that, you know, our outcomes are equitable and what we need strategies to make that happen. But we need a more diverse membership, more representation. And so the membership committee is kind of bringing that arm of it to the work. So we're meeting collaboratively.
Any questions or comments about that?
Also makes it easier for Faith, so it's one meeting instead of 2 for her.
Oh, that's right.
And then we'll also update you and send you the document that we all made. I think it was like last year. So you'll have it when it talks about all of our actuals and our goals and focus of the group as well.
Since Paul got up, does anybody have anything else? Membership things? I'll move on to HMIS Performance Measurement Committee. Amy has put together the July 2025 data completeness report that's attached to this. It's the only attachment besides the minutes for today's meeting. I just end of last week got an email from Nutmeg about updating or who we should have added to that data completeness dashboard. I want to roll it out in stages. I don't want to just bombard everyone with it. So I had said that we would start with Teresa, Paul, Sage, myself, and Amy, and Megan if she really wants it, but probably not, on how to use that data quality dashboard. Anyone can request that a data quality review be provided to them in the form of a report by requesting it from Nutmeg. So it's not like not everyone can use it, but who's actually going to be exporting the data from HMIS, saving that locally, uploading it into the new system, understanding what's being popped out and know what to do with it. Like not every user across the system is going to have that. And so we're starting with those who I know have that knowledge and can do that kind of stuff. And then once we all understand that, then we can talk about what kind of role it should have within those projects that they oversee. So agency admins, if they want it, absolutely will give it. And if they want specific users to have it, we can expand that. But so, you want Joanne to have it? Okay. Don't rely on me for all this. And, the thing that kind of confused me at first was they kept calling it data quality, but then Paul kept saying APR. So I think it comes out in the form of the HUD annual performance report, which is actually my favorite report because it comes with the stuff that we.
So it's not really data quality, it's more outcome.
Oh, data quality is like 10 questions in the APR. And so it's
a little bit. So it
It's
is
a lot. That's like half of them. Like half the questions are about data.
So it's a mixture of data quality and outcomes data? Okay, so it's not just like, are you putting stuff in well, which is very important.
Right, which we've been doing for years.
Okay, but these are the outcomes you are seeing from your excellent work.
And here are the people that don't have a social security number. And, you know, if you click here, these are the ones that haven't had an annual update that need one. Or, you know, those are just very simple examples. And there's lots more.
I just want to continue to thank and encourage those HMIS users to keep doing a good job because it really does end up mattering more so than it ever did. In both how we appear publicly, also, you know, kind of connected to what Camille brought up, it's showing our results. And if we don't enter the information, it's hard to see the results. Thanks everyone who's doing that tedious job of keeping your HMIS up to date.
We also, our HMIS end user ticketing system is this close to being up and running. We've got every HMIS end user programmed into their ticketing system. And I have a draft email that I'll be sending out with information on how to learn how to use it and how to get in. So we'll be rolling that out this week. So I'm really excited about that ticketing system. Instead of sending an email to home team and being like, hey, can you help me with this? And we'll be like, well, maybe, let me look into it. And then we contact Paul and then he knows what he's doing. It just goes directly to that HMIS team and kind of, it doesn't take us out of the loop. We're still in the loop, but it doesn't mean that you have to go through us to get to Paul or Nutmeg's assistance. And just a brief update on the HMIS policies and procedural manual. We're in talks with County Council about some of the revisions, and once we have that, we'll bring that back to the board. And that's all I have for HMIS. Amy, do you have anything to add? We did our HDIS upload today, so data that you'll start seeing online will go through June 30th of this year, pretty soon. Now I'm done.
Thanks, Veronica. Any questions or comments about HMIS? All right. We're gonna move on to ad hoc committee reports. We need to establish a 2026 point in time ad hoc committee, and I forgot how to do that too. Do I just say that? Awesome.
Who wants to be on it? That's Jessica.
You know, so we're getting on the ball early, not that early, but Pitt Count always sneaks up on us and Veronica and I were like, let's just establish the committee now. We won't have anything to do right away, but we really do need to stay on top of that and make sure that we have a Pitt committee working pretty soon.
I've got Jessica with Hospitality Center already assigned. Who else?
Contracting with the same group last year.
That's part of what this group is gonna talk about. That's actually the very first thing that this group is gonna talk about.
Well, good to know.
We're gonna need the committee to decide, do you want to contract with the same group? If you do want to contract with the same group, are there parameters you'd like to put on their assistance? We did gather some feedback last time, so we do need.
Oh,
you,
good,
Brian.
okay, that was my first question. Oh, yeah, I'm not trying to ask you.
Oh, I asked if I could be
on the committee. Oh, you're joining, that's cool.
We need at least 5. Can you add Jen Eric on specifically for North County, but sure. Hopefully it'd be helpful.
Yes. We can only have one like representative actually like make decisions when we vote, so it's just, yeah, my brain just went there, sorry.
Okay.
Joanna, I don't want to put you on the spot, but your people are usually really helpful. I don't know if you want to.
Pardon me?
I don't want to put you on the spot, but your people are usually really helpful on the pit count day. I don't know if you want to
You know, I'm sure
add somebody from your
you're gonna want to help a bit, but we're really low staff right now, which has everything to do with funding. So I would hate to obligate more than, you know what I'm saying?
Yeah.
Yeah.
Yeah, it just depends.
And this is the planning group, not the on the booth.
Yeah, no, I can't obligate them for a planning group.
Okay.
I-
We'll save them for the day of then.
Yeah, I think that's the best plan.
Have you maybe?
I'll invite Faith, and if she doesn't come, she doesn't. You can always have Jimmy come. He knows this kind of stuff.
Yeah, I have a lot going on, but yeah.
What is the commitment?
So we meet usually about every other week or twice a month. And then in January, we meet weekly. It's always virtual. It's never in person. We can meet in person if we need to. But it's an ad hoc committee, so it doesn't have, it's exempt from the Brown Act requirement, so we don't have to, it's less complicated, less noticing. And so it's, like I said, more remote, but it's the planning team that really makes the everyday decisions on how we do the point in time count.
You do what?
How do we do the street count? Point in time count.
She already did.
Oh, she's on it, okay.
Faith likes to call people out.
You're on the meeting here. Sorry, I was trying to have a quiet side conversation across the table.
This is a public meeting.
Are you interested in any people that are currently homeless being part of this? Because I have people going into our aftercare program, and this could be part of their community involvement, which is part of our aftercare program, that are currently homeless that would be interested in being on this committee.
I would love them to be part of.
Okay, I've got a couple people in mind. And I were like, yeah, yeah.
I will add you to the mail, and then if you could be the liaison between them until I
Yeah,
get
can
to know
you
them.
email me a few more things, and then I will reach out to them tomorrow and see if they're interested.
Can't guarantee it by tomorrow.
Yeah, oh yeah, okay. I know I'll see them on Thursday.
Okay.
Does that work?
Yes, I'll get it to you mid this week.
Okay, because that would be a great experience for them, and I think it would be good for the planning committee as well to have someone who's actually homeless be on it.
Yes, I would love.
Okay.
Yeah, that's great.
So last time it was like in different tiers, right? We started out with the committee and then there was a bigger group that was laying out sections, or is it all one?
I think once you have the teams assigned, like the team, like there's the counters or the volunteers, it gets a little different when you include the volunteers, right?
So we're talking about that larger planning team. And then we'll have 3 teams under that for the regions on how we actually get out in that region. Is that? And we'll decide who those leads are at, but
I think just Joanne, and I was thinking you were putting together the whole
Yeah.
team.
Not yet.
Thank you.
no, not yet,
For
not yet.
clarifying, because
Yeah,
yeah,
that's why I was
I
like,
have some people who would be good for the like what actually happens on the day of in the ground.
Yes.
Not necessarily for the.
we're not there yet.
When we get there, we're gonna be doing a much harder sell. All the silence
Oh,
will be
yeah.
okay on that time. Right now, it's just the planning committee to help us
Okay.
figure out.
Then yeah, just.
And so Veronica, I don't really quite know where my organization fits in, but when we hired the consultant agency last year, I worked closely with them to like try and figure out how we get schools to identify on that day. So I don't know, a commitment of every other week. I can't commit to right now with the beginning of the school year, but like as we get closer, however I fit into one of those committees or who we're working with again this year.
How about I add you to that leadership level? We may decide to do it a little differently this
Okay.
year and have like a larger team that makes like big decisions. And then we have a working group under them that's like, this is how we're implementing things. And then and so maybe you just being on part of that larger one that doesn't meet every other week, but rather meets like
Okay.
once a month or
Perfect.
as needed.
Yep.
Okay, we'll talk about that. But. Thank you all.
One projects, hopefully there's an update from Jeanette. Any other project updates, or is there anybody else who
I
can?
was out of town for that meeting. Were you on it?
I wasn't there. She scheduled it during a standing meeting that I had, so I won't be able to go again.
Yeah.
Anybody else make it to reentry this last month?
None of us were there.
Okay, great.
Any other project updates? Okay, for protocols and governance, none on the agenda today, we'll move on to funding.
Usually I get more of a break.
Okay, so before I jump into HAP, I don't want to forget about the continuum of care program. I was sitting here thinking with the discussions that we've been having, I don't really have a formal update for the COC continuum of care program. But I just want everyone to be aware, especially direct service providers, that it's highly likely that HUD will be releasing a 2025 GOFO. They've stated that that's going to be a different set of eligible activities than we've been seeing recently. They've specifically mentioned transitional housing as well as recovery or sober housing. And it's very clear that this administration's no longer going to enforce or require housing first as a philosophy or model. So this may actually open up some opportunities to current providers or past providers. I know there's been transitional housing providers in the past, and then when SHP went away, that funding went away. And so if anyone's kind of thinking in that way, keep an eye out. I will forward the notice as soon as I receive it and know that I have it in my inbox to the full COC mailing list. But I just really want to make sure it's on all of your radars. There's some potential funding that we haven't seen well, it's the same funding, but it's uses we haven't seen recently.
More than the current grant that's on the table for.
It's the same amount of money.
Okay, so I've already brought that up, Jane.
Okay.
So there's no additional funding outside of that.
So yes and no. There's bonus funding. So if a project was to apply specifically to the bonus funding, it wouldn't count against the current pot that we have, and it would potentially increase it. If it was a project that was not eligible for the bonus, it would be a new project that would just be competitive for the current tier 1 that is there. It could bounce into a tier 2, depending on how it was prioritized and how much money HUD puts into our tier 1. That's, well, can't really say that. We recently lost a grant. And there's multiple factors on why that wasn't renewed. But I think part of it might have been the project prioritization. And so we can look at how that is scored if our COC even decides to do that competition. We were told that it was optional before. We don't know if it's going to be required or optional under this administration.
We don't know. So the bonus projects are like, sometimes they have a specialty focus. They might be domestic violence or youth focus.
Well, there's a DV.
There's always a DV one, right?
A bonus, and then there's a COC bonus. And so there
could be yet another, you're thinking there could be another bonus for substance use or something.
Right.
We don't know what it'll look like yet.
We just won't know until it's released. Thank you.
We also won't know the full implications on, this isn't new funding, it could mean changes to our current projects that are operating under the COC funds,
Which is the
permanent supportive housing.
Right.
Funds that many of our people benefit from.
one of
So
the
there's a
things.
little thing for that to look at, just think about as a COC, like how are we gonna keep functioning, and also as a COC, you make it sound very wonderful that we're getting opportunities for new projects, but there are reasons why the COC funds moved away from transitional housing projects and moved away from the other things that are now being shifted back. And so we just might want to talk as a COC about because the other piece that's going to come with this, if the regulations on a federal level change attached to that funding, meaning what you can't do with it, how do we reconcile the state requirements for projects that are dual funded by state and federal funding streams? And how do we support the target populations that are no longer going to be supported by the federal funding streams? And so there's some pretty broad implications for what impact this is going to have on communities.
And I think we should talk about those impacts and be transparent about what we feel or see is going to be happening in our communities.
Yeah.
Because the rollout is going to impact service providers across the spectrum.
I think, the theme that's super clear, because it's showing up in Medi-Cal and CalFresh in the same language, is restrictions on able-bodied adults. So those of you who work with able-bodied adult populations, so these are adults between the ages of 18 and I think 64 now, who are not on SSI, who do not have a documented disability and are unemployed, those are the ones that are going to be, and not parenting a child over the age of 14. Under the age of 14, not parenting a child. Those are the ones that are going to have extreme restrictions on their housing, on their CalFresh, on their Medi-Cal. That's the focus. So, some of the thought processes that those of us who work with those populations are, this is the time for those individuals to start documenting volunteer service they do. Think about how they can.
The 80% level, right? 80% hours per week, work hours per week. They have to be
80 hours per month. I don't know if the CalFresh rules will translate into the housing rules, but maybe they will. It's based on, it's a little bit odd. If they're called in community engagement now, so volunteer service works, employment works, and there's another category, I can't remember what they call it, what was E besides those two. But it's like the equivalent dollar amount of 80 hours per month of the federal minimum wage. The California minimum wage is quite a bit bigger. So it's something like $500 a month. I can't remember exactly what it is. So, and those rules could change. But so the concept right now is that if you have individuals that fall into that category, able-bodied adults, not parenting a child under 14, this would be a good time to beef up your volunteer programs or find ways to start documenting things that they're doing at your sites, or because they'll need it for all kinds of benefits.
The other piece of that is you say able-bodied adults because that's the language that they use. That doesn't necessarily mean that the people that we see as just having a disability, they are.
No, I'm using the federal term,
Right.
able-bodied adults.
So meaning it's just because we know that they have a disability that gets in the way of them working, that they still would fall, like there's very limited things that meet the federal standard for disability that would waive this able-bodied adult definition.
It's pretty clear. You're on SSI or SSDI. That's where your income's coming
Yeah.
from. If you're not, you're considered an able-bodied adult.
Even though a person could be pending an application to get on.
Yeah.
I'm not sure what the pending, probably not, but I don't know.
Because, you know, we know how many times people get denied SSI before it ever pans out. And the SOAR, that's going away. It's gone. The training center that was online ended on Friday. The funding got cut.
They do have a new training platform that is implementing social security, disability, and CAPI training. I can forward that out.
Please. I saved everything I could possibly find from the Samsung website, but
Is anyone else interested in the training platform?
I'll send it out to the full COC mailing list, all like 120 of us. Thank you, Anna.
At some point, if one of my staff members has a pretty good kind of, she's distilled down the federal changes and what that's going to look like for benefits. So at the right time, she could do that quick. She's distilled down to just what you need to know for the COC if you're interested.
Maybe she could do a presentation.
Yeah, it would be fast. Again, she's focusing mostly on Medi-Cal and CalFresh, but it's in the same federal world. And I think some of the takeaways will be relevant for.
And when does all this begin?
There's sort of flowing timelines.
Oh.
CalFresh seems to be first. Medi-Cal is going to take a little bit longer. So there's different flowing things that are happening. A lot of changes for immigrants, including legal immigrants, a lot of changes for legal immigrants as well. So, and those are a little quicker.
The staff member she's referring to is Lily Caravello, and I forward out her monthly outreach partners meeting that she hosts every month, and she's going to go over it all. This one, so I'll make sure that, and I forward that out to the whole mailing list, so everybody can get it.
That's coming soon.
Yeah, I don't know exactly when, but it's coming up. I got it on Friday and I just didn't get a chance to forward it before the end of the day, before you called me. Yeah. Okay, so unless there's anything else on COC, I'm gonna go back to the agenda and back to half.
I just want to say that, like, you know, just because everybody's still continuing their own jobs and their own agencies, trying to keep up with some of those changes. I mean, and these changes are huge and they're going to impact so many people. And, you know, we already hear that the food banks are suffering also with what they get, getting their, you know, EBT cards decreased, et cetera. I mean, I think we're going to see a lot more stuff, a lot more people, you know, in need. You know, and I just wanted to make sure that we get the most updated information to make sure our staff and clients know really what's facing.
I don't wanna like, I don't want to imply that this is not a big deal. It absolutely is. But I will say only 8% of Medi-Cal recipients right now fall into that kind of ABOD category. So I think probably in the housing world, it's not all. So, you know, most people in housing are elderly, parenting children, not necessarily able-bodied. So it's still the majority are not ABODs. Not that I'm saying this isn't like super like challenging, but that is.
People experiencing homelessness.
Yeah, many people experiencing homelessness are on SSI or they're parenting children or they're in the ones that are currently getting housing vouchers. Yeah.
Not my problem.
I'm looking at the program overall. So I look at people on CalWorks. So we have a very wide range of individuals that I'm looking at in Medi-Cal and CalFresh. I'm not minimizing the change.
It depends on what population you're working with. You know how to do. Okay. Round 6 applications are due August 29th. I will have it done. Stakeholder engagement sessions, feedback. We have a summary. We've provided feedback. We're waiting for a final report that will be shared out
with the full COC mailing list, as well as all of the attendees and anyone who was invited directly to the stakeholder sessions. And I just ask everyone to distribute it to anyone and everyone who's possibly interested. We're incorporating that feedback into the HAP6 application, primarily around the key action items that we have to take to show improvement in our California system performance measures. Things like one of the goals that I'm a little nervous about are the key actions. I'm glad you're here, Jennifer, is around reducing the first time experiences of homelessness among people exiting institutions. That includes hospitals, psychiatric hospitals, jails, and prisons. And so we have to list all the funding sources that are being used locally to further that action or that strategy. And so we have a county consultant who's gathering that information and is supposed to be talking with probation and, within the county itself. But I think we're going to need some help after that discussion about how to fill in some of those holes on not just about what funding's being used, but what are we actually doing to prevent homelessness amongst people being released within those populations, released from institutions. So I'm a little nervous about that one. So I need some help. So I'll reach out. Anything else on the application that we have coming up? Did you decide that I should talk about the email we got this morning? And the HAP round 4 funding potential?
Oh,
Did I bring that up?
oh no.
Well, I don't have to say who it is.
Right, well, yeah, one of our contractors is considerably underspent and we're trying to figure out how to handle that while also meeting spending deadlines. So just those of you that do have HAP4 contracts, if you're super underspent, you're probably going to be getting some conversation between Veronica and I about how we can make sure that those dollars are being spent along the timeline that the review committee had originally planned.
And it's required by the state.
It is required by the state. So if we are unable to spend 50% or 75% or whatever it is, some sort of percentage of HAP4, it gets taken away from us. So when we first started doing the HAP rounds, it seemed like those deadlines were really far away. They're kind of coming up now. So we're having to be really intentional with our contractors. If you're really underspending, you're going to hear from us.
The state's going to be tracking it monthly moving forward and making sure that we're within our spending, like what we said we would spend each month, making sure that we're actually going to spend the money that's in our bank account that they gave us. So this isn't a reimbursement. It's a
state doesn't want to release more HAP money if it looks like counties are hoarding the money, which is not totally unfair. Yeah.
So do we have a procedure or protocol in place? It's like this number of people that applied for HAP4, right? They got a certain allocation, and then those that are underspent, like, can that be refunneled back to other projects that are like spending and using and maybe need more?
It can be, and we're just trying to figure out how to negotiate that.
Well, right around that same time that contract would be ending, because most of the HAP4 contracts end 12/31/25. We're going to have an RFP sometime before that for HAP6. And we can include the balance from HAP5 and anything that's unspent in HAP4 at that point. So we can reallocate it through a new RFP, or we can decide, these applied under this RFP and we want to do that. But we would call a joint COC social services
review committee,
funding review committee, like we did
that
before,
would
and
kind of
they would
make
make the
that decision.
recommendation. Yeah. It wouldn't be Veronica and Megan coming up
Right.
with how we use the money.
So if we have an underspender, there's like a couple different options. You can extend their contract, you could reduce their contract, you could do a combination of both. You could just extend it and keep the same amount. Like there's a couple different ways we could address it. But again, Veronica and I would be seeking input from the review committee to make that decision.
What are they underspending in? Is it
This
services?
is it's a new provider, brand new to this kind of work in rapid rehousing. And they've just had a lot of staff turnover. They haven't kind of launched it as quickly as we had all hoped, including them.
One other thing, last thing, the county, as most people should know, we operate a housing needs flex fund, that's HAP funded for the households that don't have minor children. Front Door for Families handles the requests that we get for those with minor children, and there's only a small population that doesn't meet other criteria and falls into HAP funding, but it does happen. So there's some families, but it's mostly adults without minor children. We've been seeing, and this is for both rapid rehousing and homelessness prevention. And we've been getting a lot of homelessness prevention requests for tenants with large rent arrear amounts owed. And we're seeing that a lot of them are coming from MCHSCoC. So I contacted Ashley and was like, what's going on? And because it's HAP funded and because the COC oversees that, I kind of just wanted to bring this to your guys' attention and just for transparency purposes. And Ashley had a really good context on what happened and what's going on. So I just kind of wanted to give you an opportunity to.
Yeah. It is really unfortunate that we've been seeing so many of our households that have these really large amounts owed, right? We're looking at $6,000, $8,000, $10,000 in back rents owed. So if we look at it is when COVID happened, we were no longer allowed to give pay or quit notices. We were no longer allowed to terminate anybody. When that did get uplifted last year, we realized our documentation that we've been using for decades no longer had the verbiage that we would need it to have after the CARES Act and everything else. So we had to have all of our pay or quit notices redrafted through our attorneys, had to be reviewed by our board of directors and everything. It's just been a handful of months now that we've ever even been able to start issuing out pay or quit notices. Their director did start with households who owed more significant amounts than that, unfortunately, because they had owed for maybe a 4-year period of time versus less than. We're now issuing out those notices, whether you owe $10 or $10,000, so that these numbers don't continue to grow. However, what you will see on the pay or quit notices, like we've had a conversation, is on a pay or quit notice that our CHDC issues out to a resident, we can only charge up to backwards of 12 months on a pay or quit notice that gets issued out to somebody. So it says you owe this amount for the last 12 months. And if you pay that, it secures your housing for that issue. However, if there was additional monies owed, it does not clear that amount of money owed. That amount, although we cannot use it on a pay or quit notice, does still remain owed at the time of move out. So we are seeing a great deal of them that accumulated over that period of time that we're trying to work with and through all that on an individual basis, unfortunately.
The homelessness prevention requirements from the state on HAP funding requires that households be at or below 30% of the area median income. So it's not a lot of households that we're actually able to assist that aren't, on that lower end of income. So that's another factor. There's only certain ones that we can help, and that's only if it would prevent them from entering homelessness or entering the homeless system. If they've got other resources, if they've got friends or family that they can stay with, they're not eligible for homeless prevention because they're not at risk of homelessness. They're at risk of prevention, of eviction. And so it's very clear in the regulations that this is not an eviction prevention program, it's a homelessness prevention program. So that, I'm just sharing that to point out that it's only going to be a subset of the population, even if they meet the income criteria that would qualify.
And it sounds like it would the only amount that would qualify is what can be put on the pay or quit, not the other amount.
Yeah.
Right.
So it would be a maximum of 12 months of rental arrears. Most of the time, we're limited to 6 months. And the Housing Flex Fund has a cap of $2,000 for assistance because we just had to put that in from the beginning. And so there's some that we're collaborating with, like Adult Protective Services, if they're a senior.
If they're
And they have some form of victimization or neglect going on, about seeing how they might be able to help pay some of the amount, different ideas like that, so.
I want to I really appreciate how much work is going into trying to figure these things out with the folks that are in those arrears so that they don't lose housing. That is amazing and wonderful. And we've had some clients that we've been working with everybody with, and then the other thing I wanted to ask, oh my gosh, did it just totally went whoosh? Oh, it'll come to me. It must be like 2 minutes, sorry.
I just have a question. So for the families that can't, go back that far, if they are evicted, then like, are we setting them up for more homelessness? Because if they go to collections or then like, that's now on their record, like, what does that look like for the families that can't, accumulate that amount of money? So there are, by the director's discretion on whether or not anybody's going into repayment plans, because that's typically not something that our CHDC does frequently. Because typically if you're showing a pattern of you haven't been paying, right? Unless you have been making maybe smaller payments, but once again, the payment plan is based on discretion. What I see, and every time I have to issue out one of these notices, why I reach out to community supports is try to maintain somebody's housing. Because unfortunately, if we have to go to court and an eviction is done based on non-payment of rent, now they're not going to be able to find housing with the next person. And not only that is, say, for any reason, 9 times out of 10, the other housing provider or even ourselves, we wouldn't allow them to be admitted or come back unless that amount was paid off, right? So that amount is still going to set their dwelling.
So I've a lot of these have come to Front Door for Families. So it seems like our CHDC, when they do a settlement agreement, as part of that kind of resolution package, they're trying to bring the family back to a starting line. Usually with assistance of Front Door for Families paying part of that. And I'm hoping the families can pull it off because this is their last chance. So it is turning out, like Ashley said, to be kind of on a case-by-case basis. It's unfortunate because some are just so far gone that it's too far.
Yeah.
And I don't really know what they're gonna do. And some, there's some creative solutions that can be found. But there are some tenants, it's all over the place. Some of the tenants had very shifting rent amounts because their income was changing a lot and they had a voucher and it was just, it got confusing for the tenants as well. And some tenants just stopped paying their rent.
Yeah.
Question.
Yeah.
Which is about the stop paying the rent or whatever. When you guys are, or when they're being reviewed to see, like, can the flex funds or can Front Door for Families or can any of these other sources help pay the arrears? Is there also work being done to look at how are they going to stay on top of it moving forward so this doesn't continue? It sucks to pay thousands of dollars in back payment and then the person ends up homeless anyway because they're not paying their.
That's definitely.
So a sustainable for our programs, the same for the Flex Fund, a sustainability plan is the first thing we look at. And is this a place that you can afford? Unfortunately, these are affordable apartments that many people are not paying their rent for. There's also, they were confused, they were ill, something else was going on. There was some family drama that was impacting their ability to pay their rent. Like this, every single one is always a little bit complicated. But if it's not sustainable, we can't support it, because they're not a bailout program for landlords, much as maybe they would like that. It's to keep people housed. So that's always part of the conversation. Like if they literally can't afford it.
Keep them there and to find a solution, trying to move forward, because that's, I mean, my personal end goal is always to keep everybody housed, right?
Right, and my message, this is not a good time to not pay your rent. If you lose your voucher, you're not gonna get another one. They're not coming back. So this don't just hope for the best right now. It's not a good time to do that.
Can I just say, I mean, as we get folks,
Yes.
notice services, we see those notices, and we have seen, not just from our CHTC, but from other providers, that a pattern we've been seeing is not just people not paying their rent, but there's been a problem with folks whose incomes do change, and they may be getting that additional rental assistance, but their rent doesn't change because an interim recertification isn't done, and it's not done in time, and so the rent accumulates because they're being told, just pay what you can right now and we'll figure it out later. So we've been seeing, so it's not just about like them not paying their rent. There's again, everyone is different. So we've seen that. And they get stuck with these really high, this is what you owe. And then they have to like do a repayment agreement, which puts them in the hole because now they're paying the regular rent, plus having to pay on that repayment agreement. So it's because I know that RCHDC in particular has had a hard time in terms of having like site managers to do like recertifications, interim recertifications and all of that stuff. At least that's a pattern that we have been seeing for folks.
Right, and the same with, tenants when they do have an income change, if they come and notify us within 10 days of that change, so that we can do that paperwork to then reflect on a lower amount if that's what's necessary. Sometimes that paperwork doesn't get done on a timely fashion, whether it's management side or the tenant side sharing the information, and that's why we really truly have to take each one of the cases by a case basis and look at the whole situation.
I appreciate that. As a landlord, we've run into that issue as well, where the tenant doesn't get the paperwork in, or they don't notify the rental subsidy provider that their income changed, and so their share of rent stayed at a higher amount, but even though they have no income. And I mean, it was partially on tenant, but it's also, sometimes bureaucracy and the process can take a while. So I think just us knowing when we're working with clients that encouraging them, don't wait to tell your housing that your income has changed. Like, don't wait. It is one of the most important key pieces so that you're really paying,
And don't assume they know. I think sometimes.
and don't assume,
Right,
don't assume that
they
your
know.
rent is gonna go
Well, I
down.
love my job.
just
Didn't they
because
know
your
that?
income
I know.
goes down.
We're putting off, again, I think like some people are reporting, but it's like, here's the paper and now what gets done next. If there's
Yeah.
nobody on site, if you turn in the paper and then a year later, they said like, well, how do I approve it? Like, people don't think like lawyers all the time. They just say like, write a note and put it in a Dropbox and say my income changed, what do I need to do? And if the on-site manager changes like next month, what happens? But every case is different, so, but I'm just saying in terms of what we've been saying.
That's a bleak story.
There's some bleak stories.
There's some
Yeah.
bleak stories.
And I mean, I am grateful that there is the Flex Fund and there is Front Door for Families. I bailed out is the wrong phrase, but we've been able to help people maintain their housing that I don't think would have happened otherwise. So we're super happy for that. I will say again, usually with Front Door for Families, unless there's something really compelling, we ask that the clients need to financially participate to back rent owed if they were not paying their rent for no apparent reason. So it's just, although I do get frustrated sometimes with, I'm like, I wish the landlord had done that, but I'm not in charge of all landlords. I'm not in charge of tenants either. But again, the messaging to all our clients, be really vigilant, report your income, make sure you're, get a receipt, even if it's hard, make sure you get a receipt. Do just sort of really intense tenant education is probably a really good time right now. I worry for the people who lose their vouchers. I just don't see it coming back to them and they're sunk.
Yeah.
So we will be looking at somebody who's owes a lot of money, but they're in an affordable place. And I'm like, you're never going to get this again. I want to try to figure out how to help you, preserve this. But we're spending money on it too. Money well spent, but we are spending money on helping people get back on track. I can't keep doing it over and over again. So like, they gotta get back on track and stay on track. That's the story. There are more opportunities for families with children to get back on track than always have been. There's still are. On that happy note. Yeah. Yes, I hear that.
So anything?
That's it.
All right, we're gonna adjourn the next meeting is September 15th, 2025, at 1:30 p.m. right here in this room.
Thank you. Bye, Christina. Bye, Christina.
It is.